Welcome back to our channel ADC MythBusters. I'm Dr. Poulami and I'm back today again to talk about another very popular and very requested video of ADC Part 2 examination and the details about it. Now the ADC Part 2 examination does have a few tricky points to cover, and I will make sure that I cover as much as possible in today's video. But before we proceed, it would be great if you would like this video. Comment down below if you have any other video requests, subscribe to our channel, and also share this video with as many people as possible, whether they are ADC aspirants or other dentists, so that they get inspired to start working towards their overseas dental practice and the journey ahead. So let's get started. Now the ADC practical examination definitely is a little more tricky than the Part 1 exam, but I hope today's video will help you out in getting rid of those small doubts which always arises in everybody's head after clearing their Part 1 examination. To cover a few basic details about the Part 2 examination, you will be basically qualified to appear for the Part 2 examination only after you pass your Part 1 exam. Now, after passing your Part 1 examination, your scores for Part 1 written exam stays valid only for 3 years, and within those 3 years, you are required to pass your Part 2 examination so that you are eligible to clear the entire ADC process. To give you an overview regarding the number of attempts that you might be getting during your Part 2 exam process, because Part 2 exam can be a little tricky and many a times a lot of candidates may not be able to clear it at the first attempt, which again is completely normal. So talking about the number of attempts, you would get at least a minimum of 5 to 6 attempts, which would be around 2 to 3 attempts per year, and maybe even 8 to 9 attempts, which completely depends on the ADC organization and the dates which are basically released by them. To know more about the dates and updates regarding any other exam, you would require to have a close watch on their website. Now the exam again is held throughout the year except in the months of December and January, and it is only held in Melbourne, Australia. ADC has their own exam center, which is why it makes it much more easier to conduct the examination for them, and they have a proper stimulated exam center, which again makes it much more comfortable for all the candidates who are basically aspiring to clear the exam. The exam again is basically conducted over a period of 2 days, and the 2 days and the details about it will be basically covered in this video. The first day can either be a technical day or it can be an OSCE day. There will be separate videos on each of these technical and OSCE days, so do keep a check on our channel. Now the exam pattern, like I was saying, has the technical skills day and the clinical skills day. All the technical skills day tasks are basically done on mannequin, and these mannequins are already present in the ADC exam center, so we don't need to carry them. In fact, all the materials are basically provided by ADC. The technical day consists of 6 tasks. The 6 tasks are as follows. It consists of complex amalgam restoration, complex composite or class 4 composite restoration, provisional crown preparation, PFM crown preparation for either anterior tooth or posterior tooth, endodontic access cavity preparation on a stimulated tooth, which will be provided by them, or a caries stimulation task. Apart from all of this, infection control assessment is also done throughout the 2-day examination. On the technical skills day, the conservative tasks which are there are resin composite task, amalgam task, and the caries stimulation task. The endodontic task consists of the endostimulation task, where we need to prepare the access cavity for posterior tooth alone. Fixed prosthodontics, which basically consists of fabrication of provisional crown as well as crown preparation. To get a pass in the examination, one has to pass in each of the above clusters. Now, the clusters are basically the three tasks which I mentioned above, that is conservative, endodontics, and fixed prosthodontics. You need to make sure that these two clusters, which are basically the preparatory and the restorative cluster, individually needs to be passed. Only then will you get an overall pass on your technical skills day. This also includes infection control protocol. Next comes the clinical skills day. Now, all the tasks for the clinical skills day is basically done on mannequin. This consists of total of 10 tasks, which is held over a half-day period, around 5 to 6 hours. This consists of 6 communication tasks, which is basically a communication between you and the examiner, who will be a stimulated patient. It also consists of 4 OSCE technical tasks, which basically again is done on mannequin, and it can comprise of either rubber dam application, exodontia, x-rays, etc. This day also is extremely important to maintain infection control, and infection control violation can basically lead to an overall fail of the examination. When I say this, it is very important to make sure that Australian standard infection control protocols are maintained over the 2-day exam. Otherwise, however good your exam is and whichever cluster you have cleared, if infection control is basically a miss, you might lose on the examination. Regarding the clinical skills day, the clinical skills day again is split into 3 clusters. Like I spoke about the technical skills day having 2 clusters. It consists of the clinical information gathering cluster having 2 OSCE stations, diagnosis and management having 2 OSCE stations, clinical treatment and evaluation having 2 OSCE stations, and 4 technical OSCEs. To get a pass in clinical skills day, one has to again pass in each of these clusters. When do we pass? So when you basically clear all the clusters like I mentioned, that is when you get an overall pass in the part 2 examination, and this is applicable for both the days along with infection control protocol. What happens after passing? Now, once you clear your ADC Part 2 examination, which again you will be notified via email by ADC, you are now eligible to get your registration and your license to practice as a dental practitioner in either Australia or New Zealand. We will have a separate video regarding the registration process, the form filling, and what other requirements need to be fulfilled. So, stay tuned to our channel. But post registration, just know that you are ready to go ahead with your career as a successful dentist in Australia or New Zealand. Thank you so much for watching this video. Make sure to do the needful and like, share and subscribe. Our social media handles will be mentioned down below in the description box. And apart from that, if you would want to know a little more about how you can go ahead with your ADC Part 1 journey, we do have our own coaching, so you can have a look at our Facebook group link as well as other information, which will basically help you out in kickstarting your journey towards practicing abroad. Thank you so much.